How do cytokines cause and raw flare? Imagine your joints as busy neighborhoods where cells communicate constantly. During a rheumatoid arthritis flare, certain messengers called cytokines send out signals that turn up the inflammation. These cytokines, especially tumor necrosis factor alpha, interleukin-1, and interleukin-6, become more active and drive the process of joint damage. They do this by activating immune cells and cells that line the joints, leading to swelling, pain, and tissue destruction. The flare starts when immune cells called antigen-presenting cells present specific signals to T cells, which then become activated. These T cells, especially of the helper type 1 and helper type 17, releases cytokines like interleukin-17 that amplify inflammation. They also activate macrophages, which releases large amounts of tumor necrosis factor alpha, interleukin-1, and interleukin-6. These cytokines then act on the cells in the joint lining, called synovial fibroblasts, and on cartilage cells, or chondrocytes. They stimulate these cells to produce enzymes that break down cartilage components like collagen and proteoglycans, which are essential for joint structure. This process leads to the formation of pannus, an abnormal tissue that aggressively invades and erodes cartilage and bone, causing joint deformity and loss of function. As cytokines increase, they create a vicious cycle by attracting more immune cells into the joint. These cells, including macrophages and lymphocytes, produce even more cytokines, fueling the inflammation. Interleukin-1, for example, encourages immune cells to migrate into the joint and boosts the production of other inflammatory mediators. This ongoing cycle sustains the flare and worsens joint damage. Other immune cells like B cells also contribute to the process by presenting antigens and releasing cytokines such as interleukin-6. The interaction among T cells, B cells, macrophages, and synovial fibroblasts, all mediated by cytokines, keeps the inflammation alive and intensifies the symptoms. Cytokines also influence bone destruction by activating osteoclasts, the cells responsible for bone resorption. They do this through pathways involving receptor activator of nuclear factor kappa B ligand, or rankle, leading to bone erosion that often accompanies severe flares. Some cytokines help regulate the immune response by activating inhibitory receptors on T cells, like programmed death 1 and T cell immunoglobulin and mucin domain 3. These receptors can dampen immune activity and might influence how long a flare lasts or how severe it becomes, although research is still ongoing in this area. Understanding how cytokines cause flares is crucial because many treatments for rheumatoid arthritis target these molecules. Medications that block tumor necrosis factor alpha, or interleukin-6, can significantly reduce inflammation and prevent joint damage during a flare. Recognizing the signs of cytokine-driven inflammation early allows healthcare providers to intervene promptly, helping to control symptoms and avoid complications. In summary, cytokines are like messengers that orchestrate a complex inflammatory response in the joint. They activate immune cells, promote tissue destruction, and sustain inflammation, leading to the painful and damaging flares seen in rheumatoid arthritis. Managing these cytokine effects with targeted therapies is key to controlling disease activity and preserving joint health. Always consult your healthcare professional for personalized advice and treatment options tailored to your specific situation.